Living with blood clots can be difficult, impossible even. Blood clots can make you feel sad, hopeless, and near death. You long for the days when bleeding wasn't so difficult. If you relate to any of the statements above, you need not worry longer, because now there's Warfarin. Warfarin is your one pill a day to keep the blood clots away. Warfarin interferes with the liver's ability to synthesize vitamin K-dependent clotting factors, depleting clotting factors 2, 7, 9, and 10. By doing so, Warfarin prevents blood coagulation. Your doctor will prescribe Warfarin to you to prevent or treat deep vein thrombosis, pulmonary embolism, or transient ischemic attacks associated with atrial fibrillation. It's also used post-myocardial infarction to decrease the chance of reoccurrence and fatality. To decide if Warfarin is right for you, your prescriber will obtain a complete health history including allergies and drug history. They will assess baseline coagulation studies, albumin levels, PT, INR, CBC, possibility of pregnancy, and vital signs. They will assess your history of bleeding disorders, obtain your drug history, including the use of over-the-counter medications and herbal supplements, and they will also conduct liver and renal function tests to establish a baseline. Warfarin is not for everyone. You should not take Warfarin if you are allergic to Warfarin, if you are pregnant, or if you have blood dyscrasias, bleeding tendencies, peptic ulcers, renal or hepatic disorders, or following surgery of the brain or spinal cord. The most common side effect is hemorrhage. Bleeding while on Warfarin can be fatal. Signs and symptoms of bleeding include bruising, frequent or severe nosebleeds, bleeding gums, petitial rash, hematoma, heavy menstrual bleeding, fatigue, shortness of breath, black tarry stools, and bright red or coffee grounds vomit. Other adverse effects of Warfarin include nausea, vomiting, abdominal pain, bloating, hair loss, dizziness, chills, loss of appetite, swelling in the limbs and joints, extreme lethargy, diarrhea, and joint or muscle pain. Warfarin is taken by mouth as a tablet. Follow your doctor's orders on the prescription label. You should take Warfarin at the same time every day with or without food. Warfarin starts working 3 to 5 days after taking the first dose. You can tell Warfarin is working when signs and symptoms of clotting disorders are diminished or resolved. If you are prescribed Warfarin for deep vein thrombosis, pain, redness, and swelling in the affected limb should decrease. If you are prescribed Warfarin for a pulmonary embolism, shortness of breath and chest pain should subside or resolve. Inform your doctor of any and all prescription and over-the-counter medications and herbal supplements you take. You should monitor yourself carefully for signs and symptoms of bleeding and take extra caution to avoid injuries. Be sure to eat a healthy, well-balanced diet with low fat and cholesterol. Try to eat the same amount of foods containing vitamin K day to day. Stay physically active and be sure to carry an identification card or wear a bracelet stating that you take Warfarin. You can't live with blood clots. Bleed easier with Warfarin.